My name is Dr. Anthony Nichols. I'm a head and neck cancer surgeon and a professor of otolaryngology head and neck surgery here at Western Ontario. That big long name means ear, nose, and throat is the common name. I'm also a scientist here at the London Regional Cancer Program and director of the Head and Neck Cancer Research Program. Our program really focuses on taking discoveries that we find here in the lab into the clinic to impact patient care, and we're really proud of that process. I want to give you a quick tour of our lab. Why don't we head this way? So this room here is our tissue culture room. It gives us the opportunity to study real live cancer cells and treat them with drugs and manipulate them in other ways in order to understand how these cancers evolve and how to treat them better. I'd like to introduce Sarah Bell Ryan. So she's one of our superstar master's degree students. So Sarah is studying a very rare but almost always lethal form of thyroid cancer called anaplastic thyroid cancer. And what Sarah is doing is she's studying new combinations of drugs as well as immunotherapy, drugs that help the immune system kill cancer better in order to improve cures for patients. And we're very hopeful that'll lead to a clinical trial. So here is our tissue culture hood, and this is our postdoc, Mushfiq Sheikh. And so what's a postdoc? So a postdoctoral fellow is someone who's done a master's degree and then a PhD and has gone on to further work in order to become a professor like myself. And so Mushfiq is working on human papillomavirus related head and neck cancer, also known as HPV related head and neck cancer. And what he's studying specifically is how some patients are resistant to treatment, which is usually chemotherapy and radiation, and how we can overcome that resistance. And so that's what he's working on there in the lab. Maybe we'll head over into the other area. All right, well, I'll show you the other area of the lab. So while some experiments need to be done in the sterile tissue culture room, others can be done in the regular part of the laboratory. And so in this part of the lab, we have several bays and benches where a large number of students can do a spectrum of other experiments. I wanted to introduce you to Dr. John Barrett. So he's our senior scientist within the program. We've been working together. He's been tolerating me since 2011. John is our technical expert, so the nitty-gritty and the precision nature of all the experiments at the bench side, he's the expert at. He's mentored countless medical students, residents, postdoctoral fellows, PhD students, and he's an absolutely invaluable portion of our program. Well, let's head to the other area. All right, let's go to the next area. So we'll just go into the office space here. So we have a number of areas for students to work. So in addition to the work in the wet lab, they also do a large amount of computer work. So I wanted to introduce you to Peter Zhang. So he's our superstar MD PhD student. And we now have techniques that can analyze every single gene in a tumor and look at all the molecular changes. As you can imagine, that generates a huge amount of data. And it takes a lot of computer expertise to properly analyze that data and to correlate it with patient clinical outcomes and their response to various therapies, whether it be surgery, chemotherapy, or radiation. And so Peter's done a huge amount of work. You can see this complex graph that he's been working on here to analyze a huge number of samples, and that's led to a bunch of important findings. One of the most important is this novel score, which we call UW03, that tells us the prognosis of patients with HPV-related head and neck cancers. And we've actually patented this. We're trying to develop it commercially, and we've also started a clinical trial based on these findings. And that's really all based on Peter's work.